The prognostic factors are important right now. The FISH is important, and FISH is important to be done when patients need their first treatment and also when patients need subsequent treatments, when the treatment that they're on isn't working or when their disease has come back after a period of remission. It's very important to recheck for chromosome abnormalities by FISH because patients can acquire new chromosome changes. The FISH is the single test that will help us direct treatment among all the laboratory tests that we can do. There are a number of prognostic factors that you can evaluate for patients. They're informative. They tell us how the disease might behave, but they're not necessarily useful in directing therapy. Immunoglobulin V gene mutation analysis is an important test for our clinical trial purposes. It is directing treatment. So for example, for patients who don't have a 17p deletion, but have an unmutated V gene, for example, and they're needing their first therapy, those are patients that we're developing clinical trials that are utilizing non-chemotherapy agents so that we can manage and control the disease for hopefully extended periods of time and delay exposure to chemotherapy so that we're not worried as much initially about the toxicities and the toxic effects and the bone marrow damage that you can see with the chemotherapy. And that's in contrast to patients who are young, fit, and have a mutated V gene, where we know those patients, if they get in a good, complete remission and they're MRD negative, they may be cured from their CLL. These are patients, in our experience with FCR, who we've gotten into a remission, and they've remained in remission more than 10 years, and they're continuing remission. We just reported our long-term follow-up from the initial FCR clinical trial, and there are a fair number, 2/3 of the patients with a mutated V gene are in remission beyond 10 years. So right now, FISH is very effective and useful in directing treatment, particularly in the community. For the research objectives that we have, for sure FISH is very important, but mutation status is also becoming important.